One lonely Friday evening after an atrocious week of exams, our friend Jane decided to test her luck on the dating app Tinder. A guy named Drake finally messaged her. The two decided to meet up for dinner and hit it off immediately. You can imagine what happens after the dinner. As the semester comes to a close, Jane begins to experience symptoms such as abdominal pain, jaundice, lack of appetite, and muscle and joint pain. Worried that she may have some sort of illness, Jane schedules a doctor's appointment and gets her blood tested.
Unfortunately, the results came back positive for hepatitis B virus, also known as HBV. HBV has the ability to cause an acute or a chronic infection. An acute infection lasts for about 6 months. During an acute infection, the immune system will clear the body of HBV and the individual will recover.
However, a chronic infection of HBV will result in damage to the liver and can lead to cirrhosis and liver cancer. HBV spreads by contact through blood and bodily fluids. There are common causes that allow HBV to be transmitted between person to person: sexual contact with an infected individual, contaminated needles and syringes, and pregnant women who are infected can pass the disease to her child.
Statistics show that about 25% of Americans become infected during childhood. Of those that are infected during childhood, 50% will develop chronic hepatitis B. In the United States, an estimated 850,000 to 2.2 million people are chronically infected with HBV.
The HBV vaccine is an inactivated recombinant vaccine. This means that the virus has been weakened, and pieces of the weakened virus are injected into an individual in the form of a shot given intramuscularly. The vaccine stimulates the immune system to produce T lymphocytes and B lymphocytes. T lymphocytes are white blood cells that attack cells that have been infected with hepatitis B virus, and B lymphocytes are white blood cells that produce antibodies against the hepatitis B virus, which provide protection against future infection. The vaccine is given in 3 doses and is a safe and effective method of preventing HBV. The vaccine is given in doses because it allows the body to develop the best immune response needed to fight the hepatitis B virus and provides long-term protection. Being vaccinated is the best method of prevention. All newborns, children, adolescents not vaccinated at birth should receive the vaccine. Adults should receive the vaccine as soon as possible if they are not infected with HBV. The vaccine is recommended for everyone who is at risk of coming into contact with HBV-infected blood or bodily fluids.
Jane is currently still getting treated for her hepatitis B. The treatment is going well, but it could have been prevented had she simply received the hepatitis B vaccine.